It's a new year, and, well, healthcare is already making headlines.
It always does.
But, I mean, this time it feels different, like there's
Oh,
like
absolutely.
a real sense of change in the air
Yeah.
with all the political stuff and the AI explosion.
Lovely. So much is happening at once.
Exactly. So, ready to dive into the week of January 2025. See what's shaking things up.
Always up for a deep dive.
Hmm.
We've got a whole stack of news articles, opinion pieces, you name it, all from the past week.
Okay, so mission for today, I guess it's to figure out what all this means, right? Like how these political shifts, the AI advancements, all of it, how it actually impacts people?
Exactly. And I think you'll be surprised by some of the trends we're seeing.
Oh, I bet. We've got, let's see, shocking stats on healthcare spending, some court battles brewing over the Affordable Care Act,
Oh, yeah, that's a big one.
and even a little touch of true crime, all tied to the world of medicine.
Wow. That's a lot to unpack.
It is. But let's start with something everyone's talking about, AI in healthcare.
Right, because it's not just talk anymore. It's really happening.
Exactly. Like NVIDIA, the tech company, they just released something called Project Digits, basically a personal AI supercomputer.
It's pretty incredible, the idea that anyone could have access to that kind of power. Imagine what that could mean for medicine.
Yeah, like what?
Well, think about faster diagnoses, right? More
Mm.
personalized treatments, maybe even cures for diseases that have always felt out of reach. It's all on the table now.
It's mind-blowing, really. But all this AI stuff, it's not all sunshine and roses, right? There's some concerns, too.
For sure. I mean, one study that caught my eye, it was in Nature Medicine. It found that AI models, they're vulnerable to misinformation. If you feed them bad data, they're going to spit out bad results.
Makes sense, like garbage in, garbage out, right?
Exactly. So we had to be really careful about the information we use to train these systems, because ultimately it's about your health,
Yeah.
our health.
It's high stakes. And it's not just about the data itself, right? There's this whole other layer of how AI could impact the healthcare workforce. I mean, we're already seeing experts talk about the need for physician strike regulations.
That one surprised me too.
Physician strikes because of AI. I'm not sure I follow.
Well, think about it. If AI starts doing tasks that doctors usually do, it could lead to job displacement, and anxiety among healthcare professionals.
So they might strike to protect their roles, their livelihoods.
Exactly. And that raises a whole bunch of other questions, right? Like, how will that impact the cost of healthcare? Will it make care more or less accessible?
It sounds like AI could really shift the balance of power in healthcare with both good and bad consequences.
Exactly. It's like this powerful tool with incredible potential, but it's also a double-edged sword, right? We have to be really thoughtful about how we use it.
So we've got this powerful technology with the potential to both solve and create problems, but it's not the only force shaping healthcare right now, is it?
No, definitely not. We can't forget about politics.
Oh yeah, with President Trump starting his second term, there's a lot of talk about what this means for healthcare.
Huge implications. One article I read argued that we could see major changes to the Affordable Care Act, maybe even attempts to repeal or replace it.
And if that happens, what does it mean for people who rely on the ACA for insurance? It's a big question mark right now.
A lot of uncertainty, for
Yeah.
sure. And adding to that, the Supreme Court just agreed to review a challenge to the ACA's preventive services mandate.
Okay, back up. What does that even mean?
So basically, access to things like cancer screenings, preventive meds, even things like peer EP for HIV prevention, it could all be on the line.
Wow, that's a lot to process.
It is. It feels like healthcare is being pulled in so many different directions right now.
Absolutely. But it's not all doom and gloom, is it? I mean, there are some positive things happening too, right?
Of course. There are some bright spots. Like at the state level, for example, California's new budget proposal. It has some really interesting measures aimed at protecting healthcare access and affordability.
So even with all this uncertainty at the federal level, some states are trying to step up.
Yeah, it's really encouraging to see. It just shows that healthcare is still a priority, even with all the political divides.
Okay, so we've got AI potentially shaking things up. We've got political battles brewing. Now let's dive into some of the more financial and ethical dilemmas facing healthcare. And some of these findings are kind of shocking, honestly.
Oh, I know. Get ready.
For example, did you know that research is showing women spend more of their money on healthcare than men?
It's a disturbing trend. And it raises so many questions, right? Like, are women using healthcare more? Do they face a higher burden of chronic illnesses? Or is there something deeper going on, like systemic biases in the system itself?
It really makes you wonder if the system is truly serving everyone equally.
Right. And it's not just about money either. There's also this growing focus on physician well-being, which I think is a really positive step.
Yeah, physician burnout is a huge issue, and it impacts everyone.
Absolutely. And one podcast I listened to is from Kevin MD. They were talking about how healthcare boards can actually help change the culture, and focus on supporting physicians.
It makes sense. I mean, if doctors are burned out, the quality of care is going to suffer.
Exactly. It's about creating a more sustainable system, one where doctors can thrive and patients benefit.
It sounds good in theory, but then I read this piece in the New England Journal of Medicine, and they're calling for regulations to address the rise of physician strikes.
Yeah, that's a sign that something's not right.
So clearly, there's still a lot of work to be done.
Absolutely. There are so many factors contributing to this unrest, from administrative burdens to declining reimbursements. It's a complex issue.
And then, you've got this whole other layer of ethical challenges, like what we're seeing with United Healthcare.
Oh, yeah, that story.
It's a bit of a wild one. So, United Healthcare, one of the biggest health insurers in the country, their CEO was recently killed in a shooting. And at the same time, the company is reporting these massive profits.
The tragic situation.
It is. But it also raises all these questions about, like, where's the line between financial success and ethical behavior in healthcare?
You have to wonder if those two things can truly coexist.
Right. And then there are these allegations that United Health Group was actually pressuring doctors to use specific diagnosis codes.
Oh, the ones that would bring in more money.
Exactly. And now the Department of Justice is investigating.
It makes you wonder, are they prioritizing profits over patient care?
It's a tough question. I mean, we want healthcare organizations to be financially stable, but not at the expense of patients.
Right. It's a delicate balance.
And sometimes it feels like the system just fails to put people first, you know?
Oh, absolutely. I read this one article. It was about this terminally ill woman, and it really highlights the dangers of letting algorithms make life or death decisions.
That's scary.
It is, because healthcare should be about more than just data and algorithms. It has to be about compassion, empathy,
The human element.
Exactly. We can't lose sight of that.
Okay, that was heavy. Let's take a breather for a second and talk about something a little lighter. How about those norovirus outbreaks? Everyone seems to be getting sick.
Ugh, going around like crazy.
But there is some good news, right? Moderna is working on a vaccine.
Yes, they're making progress, which is a huge relief. Because norovirus is no joke. It can really knock you down.
I've had it before. It's awful.
And a vaccine can protect the most vulnerable people, too, like the elderly or those with weakened immune systems.
So fingers crossed on that one.
Absolutely.
Mm.
But in the meantime, lots of articles are giving advice on how to protect yourself this winter. Because it's not just norovirus, it's COVID, the flu, RSV. It's a whole cocktail of yuck.
It's like we're constantly battling something.
It's true. But remember, basic preventative measures can really make a difference. Things like hand washing, staying up to date on vaccines, avoiding sick people.
The simple things.
Yeah, but they work.
And speaking of protecting ourselves, there's another threat we have to talk about. Those wildfires in Los Angeles, they're still raging.
It's heartbreaking. The impact on people's health, both physical and mental, it's devastating.
It makes you wonder how people can even begin to cope with that kind of disaster.
It's about building resilience, both individually and as a community. Having emergency plans in place, access to mental health support, strong social networks, all that plays a role.
It's a reminder that health is about more than just our bodies. It's about our environment, our communities, everything.
It's all interconnected.
Okay, I feel like we've only just scratched the surface here.
We've just dipped our toes in. There's so much more to explore, so much to talk about. Where do we even go from here?
I know, right? Well, before we jump into anything new, I kind of wanted to circle back to something we talked about earlier. Physician strikes.
Oh, yeah, that's a big one.
It is. And it's not just about, like, whether they should or shouldn't strike. It's about how we handle it, right?
Exactly. Like one article I read, they actually proposed some pretty specific regulations.
Oh, yeah, I remember that one. They were talking about treating physician strikes kind of like strikes in other essential services, like the police or firefighters.
Right. So, there'd be rules in place to balance the rights of the healthcare workers with the need to keep essential care going for patients.
So it's not about stopping strikes altogether. It's about managing them responsibly.
Exactly. They even talked about things like mandatory arbitration or like a cooling off period before a strike could happen.
It's a tricky balance for sure.
It is, but it's definitely something we need to be thinking about, especially with AI changing the landscape so quickly.
Absolutely. Okay, so speaking of AI, I wanted to talk about something else that caught my eye. Generative AI. There was this article that argued that, like, everyone needs to be involved in shaping how AI is designed, not just tech people.
Oh, I love that article. It was all about the importance of diversity.
Yeah, like having different perspectives, not just the same old tech geniuses.
Right, because if you only have one type of person designing these systems, you're going to end up with biases and blind spots.
And that could have real consequences for people.
Exactly. The article even gave this example of how some AI-generated images, they can't even accurately represent different skin tones or body types.
Wow. Yeah, I see what you mean.
It just shows you how a lack of diversity in the design process can actually, like, perpetuate inequalities.
It's almost like we're building bias into the technology itself.
It's a real danger.
Yeah,
And it's why it's so important to have artists, ethicists, patients, all kinds of voices at the table.
absolutely. Okay, so we've got AI potentially disrupting the workforce. We've got political battles over healthcare access. And now we have to worry about biased algorithms. It's a lot.
It's true. There are so many challenges. And speaking of challenges, remember that touch of true crime I mentioned? Well, there's a new threat emerging that I think everyone should be aware of. Ransomware attacks targeting healthcare.
Wait, really? Like hackers holding hospitals hostage?
It's happening. There's this one called Play that's spreading like wildfire. And they're not just after money, they're going after sensitive patient data.
That's terrifying.
It is. Because a data breach, that's one thing. But these attacks can also disrupt, like, critical infrastructure.
What do you mean?
Well, think about medical devices, electronic health records. All that stuff is connected now.
So if the hospital systems go down, surgeries could be delayed, treatments could be interrupted.
Exactly. It's a nightmare scenario.
It's a wake-up call for sure.
Okay, so we've got a lot to be concerned about. But amidst all this doom and gloom, there was some good news too, right? Something about a norovirus vaccine. Yes. Moderna announced that they're getting closer to a norovirus vaccine.
Oh, thank goodness. I mean, I know it sounds kind of silly, but norovirus is no joke.
It's awful.
Yeah.
And highly contagious. So a vaccine would be huge, especially for people who are more vulnerable.
It's a reminder that even with all the challenges, there's still progress happening.
Absolutely. We can't lose sight of that.
Speaking of progress, what were some of the other trends that stood out to you? I remember something about at-home hormone tests and telemedicine becoming more popular.
Yeah, those trends are really interesting. They kind of represent this shift toward more personalized healthcare and also just convenience.
Like you can monitor your health on your own terms.
Exactly. And telemedicine, it just makes healthcare more accessible.
But I imagine there are some potential downsides too, right?
Oh, definitely. With at-home tests, there's always the risk of misinterpretation or people trying to self-diagnose.
Which could lead to more problems down the line.
Right. And telemedicine, while convenient, it's not appropriate for every condition.
And not everyone has access to the technology or the internet connection needed for virtual care.
Yeah, that's a big issue. So it's about finding that balance, right? Embracing the progress, but being mindful of the potential pitfalls.
It seems like every advancement comes with both opportunities and challenges.
It's always a trade-off.
And it's our job to navigate those complexities carefully.
Absolutely.
Yeah.
And to make sure that innovation benefits everyone, not just a select few.
Okay, so we've covered AI, politics, finances, even cybercrime. But there's one piece of the puzzle we haven't talked much about. Mental health.
Oh, yeah, that's a crucial one. And there was this fascinating study I came across about the connection between skin conditions and mental health.
Really? I've never thought about that.
Yeah, they found that people with conditions like eczema or psoriasis, they often experience higher rates of anxiety and depression.
I can see how that would be connected. Like if you're self-conscious about your skin, it could affect your mood and how you interact with others.
Exactly. And this study actually led to the development of a bunch of new online mental health resources, specifically for people with skin conditions.
That's amazing. It's like a whole new avenue for support.
It is. And it shows how we can use technology to address really specific needs.
And to improve people's well-being, which is ultimately what it's all about.
Absolutely. And it kind of brings us back to this theme we keep circling around, health equity.
Right, because not everyone has equal access to mental health resources or even just basic health care.
Exactly. And there was this article I read that argued that AI could actually be a powerful tool for addressing this equity dilemma.
Remind me what the equity dilemma is again.
So basically, it refers to the fact that there are huge disparities in healthcare access and health outcomes based on things like race, ethnicity, income, where you live, all that stuff.
Right, like your zip code can sometimes be a better predictor of your health than your genes.
It's crazy, right?
Yeah.
But the article argued that AI could help level the playing field.
How so?
Well, for example, AI could provide more personalized care, regardless of your background. Or it could help with remote monitoring of patients, even early detection of diseases, no matter where someone lives.
It's like we keep coming back to this idea. AI is a tool, and it can be used for good or bad. It all depends on how we use it.
Exactly. And that's why it's so important to have these conversations and to think critically about both the potential and the risks.
Absolutely. Okay, we're getting close to the end of our deep dive, and I have to admit, it's been a lot to process.
It's a lot. AI, politics, finances, natural disasters, cyber attacks. It feels like healthcare is under attack from all sides.
It does, right. But in the midst of all this, it's important to remember that we're not powerless.
Oh, absolutely not.
I mean, sometimes it feels like we're just along for the ride with all these big forces at play.
I know what you mean,
Uh-huh.
but we have more power than we think.
Like how?
Well, we can advocate for ourselves, ask questions, seek out reliable information, make informed decisions about our health.
It's about being proactive, not passive.
Exactly. And the more we understand about the complexities of healthcare, the better equipped we'll be to navigate this crazy landscape.
So knowledge is power.
Absolutely.
Mm.
And we can use that power to shape the future of healthcare, to create a system that works for everyone.
I love that. Okay, I think we've covered a lot of ground today, but there's one more story I wanted to touch on, something a little closer to home. It's about a new community health initiative here in our city, focused on addressing health disparities in underserved neighborhoods.
Oh, I read about that. They're partnering with local organizations to provide free health screenings, nutrition education, even fitness classes.
It's a great example of how communities can come together to make a difference.
I love that they're not just providing services, they're also empowering residents to take control of their own health.
It's a holistic approach for sure.
And they're involving the community every step of the way, which is so important.
It really shows that you don't have to wait for some big policy change to start making a difference.
We can start right here, right now.
Absolutely. Okay, I think it's time to wrap up part 2 of our deep dive. Wow, part 2, that was a lot.
It was. I mean, we covered everything from physician strikes to ransomware attacks, even that good news about the norovirus vaccine.
It's clear healthcare is changing fast.
It always is, right.
Yeah.
But I think amidst all the challenges, it's important to remember there's still a lot of good happening too.
Right, like that community health initiative we talked about. That was
Yeah.
really inspiring.
It was. It's so easy to get caught up in the big picture, national politics, global pandemics.
But sometimes the most impactful changes are happening right in our own communities.
Exactly. Like this initiative, they're partnering with local organizations, providing free health screenings, nutrition education.
Even fitness classes.
It's amazing. And what I love is they're not just providing services, they're empowering people.
To take control of their own health.
Exactly. They're offering workshops on stress management, chronic disease prevention, how to navigate the healthcare system, all that stuff.
It's like a really holistic approach.
It is. And they're involving the community every step of the way, which is so important for creating lasting change.
It really shows that we don't have to wait for some big policy change or technological breakthrough to make a difference.
We can start right here, right now.
I love that.
Uh-huh.
Okay, so as we wrap up this deep dive into healthcare trends, what's sticking with you? What are you taking away from all of this?
For me, it's a sense of hope. Yes, there are huge challenges facing healthcare,
Yep.
but there are also so many incredible people working to make things better. And when we come together as a community, we can achieve amazing things.
I couldn't agree more. I think for me, the big takeaway is that we all have a role to play.
We do?
Whether it's advocating for ourselves, supporting local initiatives, or just staying informed and engaged.
It all
All
matters.
voices matter.
They do. And remember, knowledge is power. The more we understand about healthcare, the better equipped we'll be to navigate this crazy system.
And to advocate for a system that truly works for everyone.
Exactly.
Well, I think that's a perfect note to end on. We've covered a lot of ground in this deep dive. But this is just the beginning, right?
Oh, definitely.
So, to all our listeners out there, keep exploring these topics, dive deeper into the things that sparked your curiosity, and keep the conversation going. The future of healthcare depends on all of us. Stay informed, stay engaged, and stay healthy.